That's really quiet. Oh.
I'm turning it up.
Should we start over?
No, it's fine.
Oh, man.
Is it loud enough for you yet?
Hello, and welcome to Veterinary Journal Club. Apparently, it's been a really long time since we've done this, and I've forgotten how
9
Topher
days.
does the intro. I don't know. I was worried that my headphones weren't working right. Okay, he won't let me start over there, so you're just going to have to deal with me being an idiot sometimes.
Talking during the intro.
Yeah. Oops.
All right, this is Vet
Welcome
Book.
to Vet Books.
What chapter is it?
It's chapter 6, so it's
Vet Book
episode 7. I don't know why we didn't just like renumber it or something. Yeah, episode 7, chapter 6 of Small Animal Critical Care Medicine, 2nd edition, edited by Deb Silverstein and Kate Hopper. So chapter 6 is the chapter entitled Systemic Inflammatory Response Syndrome. And you haven't read it.
No.
So what do you think that means?
What did you say again?
Systemic Inflammatory Response Syndrome.
It's
All right, what does systemic mean?
It's when your body does things secondary to what's happening.
I mean, that's not wrong. It's also not a very helpful definition. It sounds like you were answering a test and you're like, I'm just going to
it's
repeat
like if,
some things.
It's like...
Yeah, give me some more details.
It's like if I was... had some sort of blunt trauma and I was had all this bruising and I was bleeding everywhere. All the other stuff aside from the bleeding. So like you bleed a lot, then I don't know.
No, you're doing good. You're doing good. Keep on. Keep talking.
So then like your body has to recover, but in order to recover, all this other things fail.
Okay, yeah. So you're kind of skipping ahead a little bit to mods, which is the next chapter. But okay.
I know about Minecraft mods.
I don't know what Minecraft mods
Call
means.
of Duty mods.
I don't know what that is. What does that stand for?
It's modifications. It's like when they take a game and they change it.
MODS is an acronym for multiple organ dysfunction syndrome. Lots
yeah.
of syndromes. Okay, so systemic inflammatory response syndrome. So one, it's a syndrome, which is not a disease, right? I think we've talked about this on the show before. Like syndromes are like a constellation of signs.
Talked about one of the kidney ones.
Probably. And I know we've talked about it with coagulation when we talked about DIC, disseminated intravascular coagulation, because that's a syndrome. So it's not a disease. There's not a single test that you can do to be like, do you have it or do you not? But we're saying, hey, there's certain things that will cause, individuals, their bodies, their physiology to behave in a certain way. And then there's some predictability to it, but it's usually secondary to some other disease or injury or illness. So systemic just means full body, like the full body, systemic, widespread throughout the whole body. Inflammatory, there's an inflammatory component. So that's probably the key component here.
It's what all my fitness people always talk about.
What are they talking about? Inflammation?
Your inflammation.
Yeah.
If you're ever having any sort of problems because of inflammation.
Right.
Maybe from broccoli or from working out too much.
Broccoli. I mean, you're like, what are you hitting people with broccoli? People have like an allergy to broccoli or something, I guess.
I think it's Mark Bell. Talks about fiber and stuff.
The inflammatory system is really important, right? So like if you have an injury, the inflammatory system is what brings in blood flow, which brings in cells, inflammatory cells, which are really important for healing, the healing process. The problem can become if it becomes overdone or dysregulated or just kind of it's not working the way it should.
Can you call them inflammatory cells also? Like
flammable and inflammable? Yeah. We can start if you want to.
Nobody does that?
Nobody does that until now. So your inflammatory cells, that it does give them a totally different, it makes it sound like they're flammable, in fact. That's probably, inflammation is sort of probably comes from the same root word. We'll have to look at this later. Do you have your phone? I don't have my phone on me.
Not my phone either.
We'll have to Google this later. But inflammation, because when you have tissues that are inflamed, they also have certain characteristics that have been recognized for a very, very long time. So the 4 characteristics of inflammation are heat, swelling, pain, and redness. Mm-hmm. And that heat fits with fire. The redness fits with fire. The swelling and the pain kind of also fit with fire. So I bet that was probably the primitive understanding of inflammation. It was probably why that the word has a similar, it has an the etymology.
Isn't this silly word for someone who takes blood? Like it's
phlebotomist.
Yeah.
Yeah, but phleb is like some root word, Latin for PHLEB. Like phlebitis is inflammation of your blood vessel.
Yeah.
But I don't know where that came from. Why did you bring up phleb?
I didn't know. I don't know how I just heard people say it and it's like, oh, that's a stupid name.
Yeah. Well, I mean, it's got its roots in, I assume, Latin, like everything does.
Yeah.
Okay. So the systemic inflammatory response syndrome. So this is the syndrome, how your body responds to inflammation on a widespread basis. And basically, it can be problematic because the inflammation in small doses can be helpful, but in too much can be harmful. So like if you have a local problem, if I were to like punch you really hard in the arm, and I'm very strong, don't laugh at that. It's true. Now we have to do this for YouTube. You're too far away from me right now. So I punch you really hard in the arm and then you get pain, redness, swelling, and it'll be hot because of all the pain and swelling and redness.
That would be a good video. You just punch me in the arm. It's like, look at the red. Look at it swell. Let's take the temperature compared to the rest of the body.
Yeah, we'll do our little mini experiment while I abuse you. We're not going to do that. We could probably fake it though. At any rate, locally, that's a good thing. But when it happens like everywhere in every tissue of your body at the same time, that's not so much a good thing. And I don't know if I've told this story on the podcast before. I know I've definitely talked about it, like at work when I'm teaching students about this. But usually when you get really, really sick, whether that's from something like sepsis, which is probably one of the closest or one of the most common associations between patients that have SIRS or those that have sepsis, although not all patients with SIRS are septic. They don't all have an infection. It could be from, like you said, severe polytrauma, meaning severe trauma throughout the whole body, or bad pancreatitis, which isn't infectious. So other non-infectious diseases, cancer, if it gets widespread and bad enough, can lead to SIRS. But sepsis is far and away like the most common disease that would be associated with SIRS. However, people think it's the infectious agent, like the pathogen, the bacteria, the virus, whatever, that's doing all the damage. But usually what kills the patient is the inflammatory response, your own body, usually. And the story, you've probably heard this, but when I was a resident, the oncology department did bone marrow transplants. And those aren't super common in veterinary medicine. So I'd had zero experience with that before my residency, and actually almost no experience with it since. But we were doing it fairly regularly at the time. And so animals that had like stage 5 lymphoma and leukemias, they were getting autologous bone marrow transplants. So they would remove all of their bone marrow, treat it, and then try to give the clean or the treated bone marrow back to that patient. And, they would go through a period where they were looking pretty rough. But we had one dog that didn't re-engraft, meaning they reimplanted the bone marrow back into the patient and it didn't take. Like those cells never were like, oh, this is our house again. Yeah, we just went on vacation, we're back, and we know, and we set up shop and we start doing our normal stuff. Never happened. So the bone marrow is responsible for producing red blood cells, white blood cells, and platelets. And white blood cells are the effector cells for the inflammatory system.
That means they cause it?
Yeah. I mean, essentially, like those are the messengers. So like if it'd be like they are the soldiers in your army. So if the immune system is your army, the white blood cells are your soldiers. So there's no soldiers. There's nothing, no soldiers, no new training programs being set up. Nothing is happening. And this dog never really looked sick. This dog looked fine, looked pretty happy actually. And it was remarkable. Like he didn't develop a fever. He didn't have pain, or like all of the animals that I've seen die of like sepsis or bad pancreatitis or things like that. They're miserable. They're uncomfortable. Like everything's shutting down. And this dog, that didn't happen. Now, this dog did eventually die because without an immune system, you aren't going to make it. And when we did a necropsy, an autopsy on this dog, his cells, like every cell in his body was riddled with bacteria. Like, so that's eventually what killed this.
Yeah.
In this
but
particular
most of the
case,
signs of being sick are
not there.
done by yourself.
Yes.
Like a sniffly nose.
Yeah. Like that's your
'Cause you
body's
have to
response to the
produce
thing.
mucus. It's not the bacteria producing mucus.
Exactly. The bacteria themselves aren't doing anything.
Bacteria is not raising your temperature.
No,
your body is.
It's the response to those. Like, hey, there's intruders here and we need to do something. So like, yeah, the bacteria cause a response and the body's like, hey, you're responding to something that's probably an infection. We should probably turn the heat up in this place so maybe those bacteria will want to move out.
It becomes like a slumlord.
Yeah. It's like, hey, let's make this place inhospitable. Yeah, it's true. And that's not always great for the host, right? For the patient.
Yeah, you don't want to live in a slum either.
No, but temporarily, if it means getting rid of, like, it's like your in-laws are coming to visit, not your in-laws, my in-laws. So imagine, or, you just have some, cousins that are coming to visit and you don't really like them and, but they're coming to visit again and they're coming, they want to stay at your place. And so you make the bed as uncomfortable as you can. And you say the thermostat is broken and you try to make it so they don't want to stay here. Down. Yeah. Like make all the things so they don't work. Like versus, hey, let's make this really comfortable for you. And let's, people are going to want to stay forever. So your body is, that's the situation, is trying to say, let's make this place not cool. I definitely don't want you to come here and stay with me and then have children here. Like, I don't want you to come stay with us and be like, oh, by the way, I'm pregnant and I'm due to deliver, 10,000 babies tomorrow. Like, we don't have room for this. This is not set up, So, so your immune system is trying to create the worst Airbnb experience, period. There is.
It's the lowest rating.
Yeah. Like, we don't want anybody else to come back for this. You're like, I actually don't even remember posting our house on Airbnb. We need to, somehow we got caught in the middle of this. And then once we kick these people out, we are shutting this place down. Like so yeah, this analogy got kind of weird, but, so the inflammatory response is the body's response to whatever, inciting cause that is. And there's certain things that it does. And when it overdoes it, we have a problem. We run into SIRS. And so that's, what this chapter is kind of reviewing. The problem is, I don't know if it's so much a problem, but like recognizing it is sort of tricky, like any syndrome, because it's not a disease. You can't do this one test and be like, poof, yeah, it's definitely SIRS. And, so they have, a little table in this chapter, which is the proposed criteria for the diagnosis of SIRS in dogs and cats, which is adapted from the criteria in people. And so, Topher's got to go fix the camera again. We still have to get a new camera. The criteria in people are essentially the same, but with different numbers. And so the 4 things that are proposed to look at to diagnose a dog or a cat with SIRS are the patient's temperature. Are they hypothermic or hyperthermic? So are they, hypothermic, or do they have a fever? Heart rate. Are they tachycardic, or in a cat, tachycardic or bradycardic? Respiratory rate, are they tachypnic? And what's their white blood cell count? Is it low or is it high? Now, low might be confusing. You're like, wait, why would a low white blood cell count? But when we're measuring the white blood cells in the blood, it could be that all of the white blood cells are going to the tissues and they're not in the blood. And if it's before the bone marrow has had a chance to kind of ramp up production, so you might, or you just have like an overwhelming inflammatory response. So low or high white blood cells. So in dogs, 2 of those 4 criteria would be considered consistent with SIRS. But the problem with that is, like, there are a bajillion things that aren't SIRS that can cause 2 of those 4 criteria to be off, particularly because for dogs, they said a respiratory rate greater than 20. And it's like every single patient that comes in on ER for me has a respiratory rate greater than 20. And like 36, I consider a very normal respiratory rate for a dog that's coming on ER. And so if a dog's like super excited and he's panting and he's tachycardic, that technically
all
fits
these new people.
Yeah, technically that fits the criteria for SIRS. So a little bit of common sense has to be employed essentially as well. There has to also be some underlying condition or potential underlying condition that would make sense for SIRS. So do you think there's a sepsis, some sort of infectious etiology? Was there massive trauma? Do you think there's severe pancreatitis or something like that? So it doesn't have to be infectious. It frequently is. So look for those types of things. Does it have widespread cancer? And it's, everything's shutting down from there. So
how often do you run into it?
Pretty commonly.
Yeah.
Yeah, it's common because, again, you only have one immune system and it's only got a certain number of ways it can respond. And so as soon as you have a disease that is widespread, like boom, you probably have SIRS. So yeah, it's common. It's common. Sepsis is fairly common, and you can find SIRS and have a hard time finding the sepsis. That's where actually a lot of the research and things has gone in. How do we've identified this patient has SIRS, and we're trying to find out if it's septic because we want to start treating it, but we don't like treating things inappropriately. I don't want to start throwing antibiotics at everything that has SIRS. So people have tried to look for, are there markers that can differentiate a patient with non-septic SIRS and septic SIRS? Like, is there a bacterial component or not? That would help, but nobody's been able to really be like, yeah, this will definitively tell you. So, it's good. It means we still have a job.
Yeah. Do you start going into like a protocol once you decide that there's a SIRS? Like, now we need to do these things, or is it just kind of like, hey, it's got SIRS?
It's a good question. Usually that gets narrowed down a little bit more. Like if they have sepsis, then you're probably going to go a little bit more protocolized. But if you identify SIRS, you should probably be thinking about sepsis and looking for that. So I would say, yeah, there's a lot of overlap there. But you should, if you think sepsis could be, if you don't have
what is
another
sepsis
reason
again?
Sepsis, you're going to love this circular thing. So is an infection plus SIRS. So basically you have an infection, because you could have
you have a really bad infection.
You have an infection that has led to widespread full body responding versus you have a hangnail in your toe.
Because I thought it was just an infection, but everybody says sepsis and then they say
no, because you could have pneumonia and not have SIRS and therefore you're not septic, meaning the infection is localized just to the area of the tissues that are a problem. It's still problematic.
Yeah,
having pneumonia is still bad.
Most is like septic belly. That's the word.
Septic abdomen. Yeah. So usually what happens there is an animal has leakage of their gastrointestinal contents or intestinal contents into the belly. Yeah, food, but also bacteria. Your intestines are full of bacteria. So as soon as they leak out into the belly where they're not supposed to be, yes, you have a septic abdomen. So sepsis means septic, like antiseptic is cleaning things and trying to get rid of bacteria. But sepsis, the term usually implies if a patient has sepsis, it's full body. Not that the infection is necessarily everywhere, but the response to it is. Yeah. Does that make sense?
Yeah. I was always heard infection and sepsis, and then I thought it was just an infection. It's like, but why do they use the two different words?
Yeah. So an infection, all septic patients have an infection, but not all infectious patients have sepsis.
Yeah. Sepsis is a square.
Yes.
Infections are rectangles.
Yes. Okay. There you go. I was like, what are you talking about? Yes.
Talking about polygons.
Yes. Well done, babe. So, yeah. That's kind of the deal. How do you think you treat SIRS?
Probably check and see if there's an infection. And if there's an infection, do whatever antibacterial, antiviral.
Mm-hmm.
And then
so treat the underlying cause.
Yeah.
That's how you treat SIRS.
Okay. Yeah, you probably just wait it out.
So it's treat the underlying cause. Alive. Try to identify and treat the underlying cause, and then just support them through that. So
because their immune system will go back to normal
if they can clear the infection, or if it's like pancreatitis, then it's more of a wait it out. So if it's got a treatable condition, then yes.
What happens to your white blood cells when they're released? Do they come back?
No. They die. They do their job and then they die, and then you have to make new ones. The lifespan of a white blood cell is like hours.
Is a white blood cell, is that a T cell? Is that what I'm thinking?
Those are a type of
because there's
immune
T cells,
cells,
macrophages.
Yeah, so those are a type of immune cell, and they all have slightly different jobs. So usually when we're talking about inflammatory cells, we're talking about neutrophils. Mm-hmm. Eosinophils, basophils. Neutrophils are the big one. Lymphocytes of your T cells and B cells are a type of lymphocyte. Mm-hmm. And then macrophages. So the three big white blood cells are neutrophils, lymphocytes, macrophages, which are called monocytes in circulation. And we call them macrophages when they get into the tissues. It's dumb, but that's what we say. And then there's a couple other ones that...
So they just kind of get dispersed and then they just dissolve away.
Well, they're circulating in the body and then they go out into the tissue. So they leave the bloodstream to go into the tissues and do their job. And then once they've done their job, they're like, all right, you've done your job and we are going to replace you with new, young, fresh troops. And you are now retired. And by retired, I mean dead. Yeah. Yeah, they're designed for that. they're more like robots than soldiers. Then let's go. They're robotic soldiers.
Mm-hmm.
They're like, I don't know, futuristic robot soldiers. I don't know. That's all I got.
Organic nanobots.
Yeah, they're organic nanobots. That's exactly what they are. Yeah. Designed to be sacrificed. They only last a few hours. So like if they don't, they go and do their thing and then it's like, all right, peace. I'm done. Goodbye. So you're constantly making new ones all the time.
In your bone marrow.
Yeah, exactly right. So yeah, I don't know. What questions do you have about SIRS?
Do you guys call it SIRS?
Yeah.
Yeah?
Yeah, we do.
Use that? Because I don't feel like I hear you use that word that much.
Yeah, it's because it's usually, like, I would talk about it, more from a educational standpoint, like you need to recognize these things and what you're going to look for. But typically it would be like, oh, this animal has bad pancreatitis. It also has SIRS. Like the SIRS doesn't tell me much other than the fact this is a very sick patient, which I don't need. And, like you already know your patients are sick. It's more just like, hey, this is got signs of SIRS. I should be on the lookout for what is causing it.
Yeah.
I should look for sepsis. Unless I'm like confident it has pancreatitis or some non-infectious cause of SIRS, then I should be like, I need to go looking for that. And I might need to pull blood cultures, or I might need to pull, other samples to submit for bacterial culture. Because the big thing is, even if you have sepsis, it doesn't mean it's bacterial, right? So viral sepsis is huge as well, as we've learned in 2020, 2021. Viral sepsis kills a lot of people.
Yeah, is that what the COVID stuff is?
Yeah, it causes a viral sepsis. So, some people will die from their respiratory distress. Or they can't breathe because they have horrible pneumonia, but other people die from SIRS, essentially in multiple organ dysfunction syndrome, which is the next chapter.
There was the previous corona was SARS, right? Or one of the early ones.
SARS can cause SIRS.
I think I remember them talking about that in the news, the SARS and SIRS, and it was like, what are you guys talking about?
Yeah, acronyms.
Yeah,
they'll get you. Acronyms have been killing people for a long time. All right, that's. I don't think I mentioned who wrote this chapter.
No, you didn't.
I apologize. Armel de la Fourcade. I'm sorry, Armel. She was part of the last chapter too, but she wrote this one all by herself.
Ooh.
Yeah. So,
all right, I get the book
thanks,
now.
Armel. Oh, you get the book now. Okay, there you go. Careful with it. It's very heavy.
Why is it so heavy?
It's a big book. A lot of stuff in there. Okay, so are you going to quiz me now, or?
Yeah, I think we're gonna do.
Uh-oh.
Let me get my sound effects up.
Yeah. We were super prepared again.
I think it's this one. Oh, I gotta change
There's no sound.
I think it's gonna be a spelling bee.
These are always good. All right.
So your first word is syndrome.
Syndrome. SYNDROME. Syndrome.
Oh, yeah.
Wait, what happened to my cheering section? Oh, okay, that'll work.
Correct.
That's my
All right,
bicycle bell.
Another one. We've been doing these on the fly, so I haven't had a chance to prepare.
Yeah.
So that's why.
Yeah, maybe you should start. Oh, you got a good one?
Yeah.
Okay. Can you pronounce it?
Probably not, but you'll know what I'm saying. Cholestasis.
Cholestasis. Yeah, you said it right. Good job. All right, you ready?
Yeah.
CHOLESTASIS. Cholestasis. Boop, boop, boop.
Darn.
Yeah.
All right.
I see these words all the time.
Whoa.
I love your reaction to the words. This is great.
I'm just looking around and I found a sentence that's got three. It's actually got four difficult words, and then one that I know is a commonly misspelled word.
Ooh.
But that's not one of the, I think you would get that. We'll give you the commonly misspelled word.
Okay, let's hear it.
Occurring.
Oh, that is a tough one.
Yeah.
All right. OCCURING. Occurring. Is it got two R's too?
It's got two R's.
Son of. That is a tough. Yeah. It's easier if I've typed it or written it down, but yeah.
Well, because it gives you that little red squiggly
No,
line.
but sometimes it just looks wrong. You're like, wait a minute.
Yeah.
I was trying to imagine it in my head.
Well, it's like
I
the
knew
word
it had
left.
2 C's.
Every time I type the word left, I'm like, that's wrong. That's not a word.
Really?
Yeah, I don't know why.
That's funny.
Well, we've just been watching Ted Lasso, and he does the thing where he like repeats a word in a couple of the episodes.
Yeah.
And I was like, oh, it's like that when I write some letters.
That's really funny. I think the problem with occurring is I know there's 2 C's. And having double C's, double R's feels wrong.
Yeah.
Anyway, give me some medical words.
All right, I got the 3 other that are in this sentence.
All right, let's see if I can get the rest of them. I've already missed
Okay.
one. This is disappointing.
Glucocorticoid.
Glucocorticoids.
Yeah.
All right. Is it plural or no?
Singular.
All right. Glucocorticoid. 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 Yeah, give me medical terms. Don't give me occurring. Ridiculous.
Intravenous.
Intravenous. INTRAVENOUS. Intravenous. Ooh, different praise sound.
And the last word, since you've already missed one, I don't have to go that hard. Immunoglobulin.
Wait. Hang on.
Globulin.
Okay. Immunoglobulin.
Yeah.
IMMUNOGLOBULIN. Immunoglobulin. Boop, boop, boop. All right. Yeah, don't ask me to sell something. Just give me the medical term.
There's so many words. Like there's like height.
What was the sentence? Read the sentence.
Oh, low dose glucocorticoid and
glucocorticoids.
Intravenous immunoglobulin administration warrant further study in animals with naturally occurring disease.
2 R's. I can't believe I missed that.
Yeah.
All right.
There's
sorry, team.
all kinds.
Hey, buddy.
I wish I had had more time to spend with this one.
Motor, you going to come sit with me? You're the best boy.
I think that's the first time a cat's come up with you during the show.
That's because Motor's a good cat.
He's just sad that you misspelled occurring. He would have gotten it wrong too.
I don't know. He's pretty smart.
All right. So for the next episode, we're going to have, it's going to be MODS.
Yeah.
Multiple organ dysfunction syndrome.
Another syndrome. Bum, bum, bum. I don't know what that. Yeah.
Oh, wait. I got it.
It's part of a theme. What do you got?
I got it.
All right. So that will be chapter 7. Ooh. Chapter 7. Yeah. So join us next time for our next episode of Vet Books. And we will talk about... God, how long has it been since we recorded? We're both struggling tonight.
9 days.
I was gonna say it is whatever time it is. 8:00 on a Sunday night. It's the end of a week.
Yeah. I don't have to work tomorrow.
You don't have to rub it in.
I didn't find out about that till Friday.
Every time. So, all right. Well, thank you for joining us, and we will catch you next time. Bye.
Bye.